A bunion is something that people think is a minor condition a lot of times, but in reality, a bunion is actually more than just a bump of bone on the base of your big toe. Actually, what a bunion is most of the time in patients is not only just a bump on the bone right here, and it's not actually the base of your big toe where the bump is, it's this bone behind it. This is your big toe, and this is the bone behind it called your first metatarsal. So what happens is you'll get a bump that develops here on the head of the first metatarsal, but then over time, this bone will actually start to splay out and become more and more prominent. So basically what happens is you've got this very prominent bone rubbing on your shoes. A lot of women will notice their bunions because they wear tighter dress shoes or heels, but certainly men or women can get bunions. To treat it, we can start conservatively with wider shoes and a pair of inserts or maybe some pads to protect the area. But as you can see, if this bone is starting to splay out and become prominent on the inside of your foot, really it's a structural problem. So there's some procedures that we do to help fix a bunion where we actually reposition the bone in addition to shaving off any bump. It's extremely successful. We use a pain pump, which is a device to really minimize patients' pain. A lot of patients will take no pain medicine after surgery, which I know is somewhat unusual for a lot of surgeries. Patients are taking a lot of oral medication to control their pain. So we strongly advise using a pain pump to control the effects after surgery. It lasts for about 4 days. You can walk right away after your typical bunion surgery. You are in a boot for about 4 weeks, but after that, we get you back into some regular athletic shoes and progress you back into your regular activities.